I'm Dr. Tim Kaczynski from Michigan, and today we're going to demonstrate a grafting procedure using DirectGen from Implant Direct. Our patient today has a non-restorable maxillary right first molar that has root canal therapy, and the endodontist deemed that the tooth was no longer functional or restorable. We will extract the tooth atraumatically using the golden physics forceps. Now, the maxillary first molar is a very interesting tooth because it has 3 roots on it. And when we extract it, we're going to create 3 sockets. So immediately placing an implant is nearly impossible, or it's very difficult to put that implant in the correct position. So following extraction, we'll curette the area, and we will graft the site with DirectGen cancellous cortico allograft from Implant Direct. This material will be allowed to heal for about 4 months prior to placing a dental implant in the future. Now, we're taking out a fairly large tooth, so we're going to have to put some type of barrier to protect the grafting material. And to do that, we are going to use a non-resorbable material called Cytoplast, again from Implant Direct. We'll suture that in place, and hopefully we'll be able to demonstrate a really nice technique for you. To remove this tooth, this maxillary first molar tooth that's kind of badly broken down, as we'll demonstrate in a few moments, I'm going to use the golden physics forceps. This tool has been just outstanding in my hands, and it's allowed me to atraumatically remove a tooth without damaging the buccal plate. Now, when we're extracting a tooth, we want to do it very atraumatically. If we have socket sites, we can easily graft the area or the sockets and allow for outstanding healing. So let's demonstrate the use of the golden physics forceps. And you can see the forceps has 2 components. If we get a little closer to the tip, we have a beak, which is a flattened edge, and what is known as a bumper, and it's just a silicone protection. We're going to engage the beak onto the palatal surface of the root, deep down onto the root surface. Now, sometimes I have to take a burr and flatten that root surface to compensate for the blunt edge of the beak of the golden physics forceps. So we'll do that. We'll demonstrate that in a few seconds. And then I'm simply going to use rotational motion to elevate the tooth out of the socket. So if we can get a close-up view of the tooth itself, and you can see that we have a very badly broken down maxillary first molar tooth that was deemed to be non-restorable. So the first thing I'm going to do is I'm going to take a handpiece, and I'm simply going to flatten the palatal surface of the tooth about 2 or 3 millimeters subgingival. I will then engage the beak of the forceps. Now, I'm right-handed dentist, but I'm going to use my left hand here for a video demonstration. I'm going to engage the beak of the forceps onto the palatal surface of the root. The bumper is engaged as high up the vestibule as possible, and I'm simply going to rotate my wrist, and if we can back off into my hands, you can see I'm barely holding the forceps. I really have it in the palm of my thumb and really one finger, and I'm rotating my wrist. No forearm, no bicep pressure. I'm rotating my wrist really towards the corner of his right eye. So I'm using rotational motion, and it may take a minute or 2, which is a long time for a dentist. Sometimes you need a little purchase point on the root of the tooth. And again, I'm using my left hand. I am a right-handed dentist. And I'm rotating my wrist. And you saw that tooth just pop. Now, the instrument is not intended to remove the root completely, and we'll simply take a forceps and we're rotating using my tooth removal instrument to remove the tooth in total without any complication. Buccal plate is intact. We have a great buccal plate, and we have 3 sockets that we simply have to graft. The next step is to really curette the sockets very, very, very efficiently. Curette, 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 stop, curette, curette, curette. And as I mentioned earlier, we're going to use the direct gen material, which comes in 2cc vials. I like to use the 250 to 1000 microns in size. It allows for nice packing. And what I've done is wet the material so it almost becomes a putty. It allows me to place it into the socket very effectively. Now, one of the things that we have to do is, when we have any type of grafting material, we have to use a barrier to protect it. Tissue grows much faster than bone, so what I'm doing here is just taking a simple elevator and I'm loosening the tissue so that the barrier will end up about 2 millimeters onto the bone surface on both the palatal and the facial. The Cytoplast material, this is a non-resorbable material because we're not going to be able to get very close contact in a molar tooth. Comes in sheets, and what I'm going to do now is cut this sheet to the proper size. What I've done is I've cut the barrier that we described earlier. The smooth side will go towards the socket, the roughened side towards the tissue. And what we're going to do now is we're going to place the barrier first in the proper position and then place our allograft material. Now, it's very, very important when we're using a barrier, and we have to use a barrier, that we properly position it so that it fits very passively. We will be suturing it in place, but the biggest mistake that doctors make is they fold it, or the material is not engaged 2 millimeters onto good bone facially and palatally. So we're going to try this in first to make sure we get a passive seating of the barrier. So you can see I was able to place our barrier onto solid bone on the facial. Eventually we will fold it over onto the palatal surface and then suture it in place. But before we do that, we can go ahead and use our barrier material. So we're taking our allograft material and I'm simply placing it into the socket site. Now, if some of it falls into the mouth, you don't want to use that. And I'm just taking a packer and I'm lightly packing the material into the sockets. I'm not crushing the material. And we're filling the socket site with our material, gently packing it into position. Now, we're not going to get excessive height past the CEJ of the adjacent teeth. And again, you don't want to use anything that's fallen into the mouth that's touched the saliva. The final thing we're going to do is take our barrier and try to passively insert it onto the palatal bone, and then we're going to suture this into position. So you can see we have a passive fit. We don't want any bending at that position. We're just doing a little X here in our suturing to hold the material down, or hold the barrier down. And once we get that first one, it's usually pretty stable. Okay, so I have 2 cross stitches, and I'm going to put some vertical sutures to to really hold that material into place. So you can see my non-resorbable barrier covers the extraction site. We would never get complete closure. We have cross-stitched and 2 vertical sutures to hold the non-resorbable barrier in place. I will bring this patient back in 1 week to remove the sutures. I will leave that non-resorbable barrier in for about 4 weeks, after which I will just pick it out and let the graft site heal for a minimum of 4 months prior to placing my ideal dental implant in the future. Again, we did not place an implant immediately because we have 3 sockets that are almost like the fingers of a bowling ball, or the holes of a bowling ball, and I would not be able to place the implant in an ideal position. If I put it in the palatal root, then the final crown would be too palatally positioned. If I put it in the mesial or distal root, then the implant would be too facial, or we would have a cantilever either towards the mesial or distal. We want ideal position, and we were able to do this graft very efficiently, very effectively, with very little trauma to the patient.
Very much for your interest in learning about the physics forceps. Not only are they fantastic and they work atraumatically, we are offering you a 90-day money-back guarantee. Use them for 90 days. If you're not 100% satisfied, send them back and we will happily refund your money.
For more information and to watch several more clinical videos, please visit physicsforceps.com or call 1-877-987-2284.